All right, it's time for Ask the Derm with board-certified dermatologist Dr. Billy Groff from Cosmetic Laser Dermatology. He's here to answer all of our skin questions, and today it is all about the hands, right?
All hands on deck
all
for
hands
this segment.
all the time. All right, let's go ahead and get to our first question,
Okay.
which wants to know, as I've gotten into my 50s, the veins on my hands are getting more noticeable. Is there any treatment to diminish these? And Nita from Temecula wants to know. We've got a picture right there. I feel like your hands can really show your age for sure, and this happens to a lot of people where these veins pop out, right?
Right. Well, what happens is the skin gets thinner, and just like with leg veins, the veins tend to dilate and get larger over time. They get weaker as they age as well.
Right.
So we actually do the same treatment that we do on leg veins. So we use this foam solution. It's called Sotradecol or Polydocanol, which is a type of detergent. And if you watch here, what I do is we make it into a foam.
Huh.
I'm using a tiny, tiny needle. We're able to go into the hand where the veins are, and usually it only takes maybe 1 or 2 injections to get this product through the hand, and that takes care of the vessels. So it's pretty amazing. It's actually a very easy treatment.
And we have a picture to show after of what we're talking about. How soon are you going to see those results right there?
Well, the vessels get smaller immediately, but then they tend to shrink down over a period of about 6 weeks.
Okay.
Yeah.
Next question. I went this past weekend for a gel manicure, and for the first time ever, my manicurist applied sunblock to my hands before I went under those lights to dry my nails. Can these lights actually cause skin cancer? Stacy from La Jolla wants to know.
Yeah, this is actually a fairly new phenomenon where when you go in to get a manicure, they're going to put this sunblock on your hands because this light source is actually ultraviolet radiation. Now, although it's very low intensity, if you do a series of manicures over a period of time, you're going to build up enough damage that you can increase your risk of skin cancer.
Huh.
So if you're getting these gel-type manicures where you put the hands under the UV light, you should make sure that they apply sunblock to your hands before you go in there.
Interesting. I never would have thought of that.
Yeah,
All right,
yes.
next question. I can see the tendons in my hands, and they look bony. Yikes. What can I do to improve this? We have a picture to show you of what we're talking about right here.
Yeah, so again, with aging of the hands, you lose volume just like you lose volume in the face. And the same fillers that we use in the face, we can use to add volume to the hands. So if you want to get the upper hand on aging, you place a little bit of filler in the hands. And the
So is
fillers,
it that same stuff that you just showed us? Or is
yeah,
it different?
well, no, this is different. We like to
Okay.
use one product we use is called Voluma, which is actually FDA approved to fill the cheeks, but we use it to fill and soften the hands as well.
Interesting.
Yes.
Okay, next question. I have this weird rash on my hand. Can I put hydrocortisone on it? And we have a picture to show you of what we're talking about. Ooh, yikes, that doesn't look good.
Yeah, that's an interesting rash. You see how it has that raised, kind of rolled looking border?
Yeah.
And the central area is more flat? This is classic for a fungal infection on the hand. So the same fungus that we can get on our feet or in the groin area can affect us in the hands. So a lot of patients, what they'll do is they'll try to self-diagnose or self-treat, and that's when you can get yourself into real trouble. Because one of the most common creams that it's bought over the counter is hydrocortisone. Now, if you put hydrocortisone on that rash, it actually weakens the immune system in the hand, and the fungus can just proliferate or multiply.
You're
So
kidding.
we have a picture actually here of a patient that I saw. I think we should have a photo. Aha, yeah, here we go. So this patient had this rash in the first photo. She applied a topical steroid like hydrocortisone to her hand, and look how it blew up. I mean, the fungus
yeah,
just went
yikes.
crazy. So you got to be very careful about self-treating. So she came in and saw me, and I put her on the appropriate medication, which is actually an oral antifungal medication. You can see how it cleared it up pretty nicely.
Okay, last
Yeah.
question. I have noticed my hands look old with all these brown spots. What's the best way to get rid of these in one treatment? That's the key. They want to know one treatment. We have a picture to show what we're talking about right here.
Yes, you can see she's got kind of mottled pigmentation and brown spots. So hands down, the best treatment for this is using a combination. What I would do is I would use a combination of intense pulse light, which is a kind of, you can think of it as like a laser treatment, and then what's called a Q-switched alexandrite laser, where we can target individual brown spots. They get a little bit darker initially, and then they just gently flake off the skin over a period of about 2 weeks.
It just flakes off.
Yeah, and you can get, I'd say, 90 to 100% clearance with one treatment.
Interesting. Very good. And that's the after right there. Good stuff.
Yeah, it is.
To get in touch with Dr. Groff, the information is going to come on your screen in just a second. And there it is, right there. And we've also got more information also on our website. Just go to fox5sandiego.com, click on that Scene On tab. Doctor, thank you.
Thank you.
Appreciate it.